GPs in England have told the BBC they are facing a tsunami of patients as the country emerges from lockdown. NHS figures show more than 28 million appointments were made in March, one of the highest on record.
The Royal College of GPs is warning that without urgent resources, they will no longer be able to meet patient demand. Here's our health correspondent, Dominic Hughes.
Every day I wake up thinking, is this going to be the day that I can't do it anymore? I've already marked that ultrasound scan as urgent, haven't I? We have almost a tsunami of patients coming to us. It feels like the river has flooded the banks.
And then I've got to follow up with the cancer guys.
It's going to sting a little bit. I see no end of it stopping. It just keeps coming and coming and coming in this one massive, endless wave of patients.
The start of another busy day.
Right, phone lines are open now. We need to get cracking with the day's work.
And Dr. Dean Eggett is already feeling the pressure.
It's 8:30, bang on the dot, which is great. Which means that we can start consulting now. And I've got 1, 2, 3, 4, 5, 6, 7, 8, 9 patients waiting for me.
Hello?
Morning, it's Dean speaking, Dr. Eggett. Are you still seeing the guys up at the hospital?
The easing of lockdown has released a huge amount of pent-up demand from patients needing help, many of them with multiple complex health problems.
So you're just working away through a long list of phone numbers?
Yep.
That's your appointments, in essence? Yeah.
In essence, absolutely, yeah. In terms of help, what sort of help would you like? I'm now starting to run out of capacity for those patients who need me urgently today or who are trying to book ahead. I've never experienced anything with the workload pressures that I've got at the moment, of the number of patients that I've got, the complexity of the patients that I've got, and the mental intensity of the workload. People are incredibly sick.
I need a prescription to be able to get some strong painkillers.
Absolutely, we'll sort it for you. Obviously, with your mum having dementia, the situation is never going to get better.
No.
Is this how you saw your career? Did you know that this would be the kind of pressure you worked under?
People can't see what we're doing, so they think we're sat here twiddling our thumbs, when actually we're sat here holding our head in our hands, thinking how we're going to cope through the day. There is this hidden demand and hidden workload that nobody gets to see.
So are you okay to take a call back this morning?
In reception, the phones are ringing constantly as patients try to get an appointment.
Busier than we've ever been. I can still hear the phone ringing when I go to bed.
But Dr. Eggett worries about those who can't get through.
You know, in medicine we're taught not to worry about the people who shout, we worry about the people who can't shout. But actually in the NHS, they don't even get a voice. They don't get on the phone, they don't get through to us, they're just unheard.
Some people simply can't be assessed over the phone.
Do you want us to just keep an eye on you and keep you fit, rather than do anything to...
That's right.
Okay.
A 97-year-old patient with some worrying symptoms needs a house call.
So this is exactly one of those circumstances where you really need to see the patient face to face?
Yeah, absolutely. I mean, there are several reasons why we need to see the patient face to face. First of all, because you need to lay hands on the patient to help make the diagnosis of what's going on. But secondly, because we're talking about something so serious, you need the human touch. So you've got a nerve and an artery up here. I'm just making sure there's not damage.
Back at the surgery, the appointments are put on hold. Mitchell has walked in with a nasty cut above his eye.
Okay, I'm going to stitch you back up.
This minor surgery keeps Mitchell out of A&E, but it adds to the time pressures Dr. Eggett already faces.
The NHS for the past few years has almost been pretty constant. So instead of that massive winter peak and the summer lull, you've still got a massive winter peak, but you don't have a summer lull anymore. You've got that constant work. So the ability to catch up has gone. That was before COVID. Then COVID hit, and then it's just peak, 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 peak all the time. Who's that from?
Your patient that you've just stitched back together.
Oh, how beautiful. Oh, thank you very much.
That's nice.
That's wonderful, isn't it?
Yeah, yeah. You look very moved.
No, I am. You don't go into this job to get thanked, and the fact that somebody feels as though they had to go out of their way to do that is almost upsetting in itself.
The Department of Health and Social Care in England says extra funding is available to help GPs, and there's a commitment to expanding the workforce and delivering more appointments.
I adore my job. I think I'm okay at it, and I'm glad I make a difference with my patients. What I need is the system to help me be better than I am. Congratulations, team. You're loved. You're amazing.
Well done, everybody!
Well, that was a really interesting glimpse, wasn't it, about the reality of what GPs, doctors, hands-on are having to deal with every day, the pressures that are on them now.
I think when that doctor just said, you know, a lot of people think we're sitting here, don't know what we're doing. It's very difficult to see what's happening on the other side of the phone, isn't it, or the other side of a screen. And he said, well, you know, people think we're sitting here twiddling our thumbs when actually we're sitting here with our head in our hands. That's quite striking. Dominic Hughes there reporting for us. And we'll hear more from Dominic a little later on in the programme.
6:21 is the time now. We're going to have a look at the papers for you on a Thursday morning. And you may not